Hello, everyone. This is Gail, aka Sunshine. Today we have Valarie Traynham joining us around the campfire, and we're going to do episode 1 today of a two-part episodes or series. So, Valarie, thank you so much for joining us.
Awesome. Thank you. Thank you all for having me. I'm excited to be here.
So, we're going to be talking about clinical trials in both episodes. Today, we're going to focus on more understanding challenges and root causes of inequities. So, just to kind of give you a taste of where we're going. So, Valerie, what I'd love to do first is just get to know you a little. So, can you tell us a little bit about yourself? And if possible, please include one fun fact.
Ooh, a fun fact. Well, I am Valarie Traynham. I live just outside the suburbs in Chicago, Illinois. I'm a country gal at heart. I'm originally from the southern part of Virginia area. I've been here for about 12 years now. Kind of gotten used to everything in the Midwest except the traffic and um, the cold weather. So
Yeah,
it's kind of a warm day out today. So I'm excited about that. But I am a multiple myeloma and breast cancer thriver. I've been on my cancer journey for about 10 years, celebrating 10 years this year of the
congratulations.
myeloma. Thank you. And 6 years of the breast cancer. Right now, I do a lot of patient advocacy work and just making sure that the patient voice is heard, educating communities of color, particularly about clinical research. We think about cancer statistics and just that underrepresentation that we are looking at. So I try to get out and educate those communities on clinical research and get them involved so they understand what it is, but also what it is not there. So
Yeah.
in my free time, I enjoy being out in the woods, doing a little hiking, biking. I do a little reading. And I'd say one fun fact about me is I like anchovies on my pizza. I know a lot of people are like, ew, anchovies, but I'm like, yes, bring them on.
All right. Well, and that is the first time anyone has shared that fun fact, as far as I know, on our podcast. So thank you, Valerie, for
Yes,
sharing that.
yes, of course.
So I want to go back to what you were just kind of saying. What are some of the historical, systemic, social factors that have contributed to the ongoing disparities in healthcare access, and particularly for what we're talking about, clinical trial participation, and also specifically for racially diverse communities and people with disabilities?
Yeah, so I think about, when it comes to medical mistrust, in these groups that you just mentioned, um, it's deep rooted,
Hmm.
it's historical, it's systemic, and it runs deep. It runs from a legacy of, I would say, just exploitation,
Hmm.
neglect, exclusion, those types of things, in healthcare and medical research. And we think of some of the more common ones that come to mind. Some of the common examples that come to mind are the
Yeah.
Tuskegee syphilis study. This was a study where Black men were essentially deceived and denied treatment. Another that comes to mind is the Henrietta Lacks, the
Hmm.
unauthorized use of her uh, cells that are currently been used in healthcare for many, many years. Also, things like the forced sterilization of women. Those types of things come to my mind when I think of some of those past hurts and things. That in a combination of just implicit bias that we don't even think about, the unequal treatment and lack of representation in clinical trials.
When you say lack of representation, I don't know if it's a conscious or unconscious decision on the part of the doctors, but are they basically not asking people of color or with
Yeah.
disabilities to participate?
Yeah, yeah, it is a combination of that. We do find that some patients are not asked if they want to participate in a clinical trial. And again, it's because of
Mm.
bias. It's that assumption that, oh, well, you're too busy, or you may not be able to get back and forth to the treatment site. And um, I didn't think you would be interested. It's
Mm.
those types of things.
Yeah.
Um, yeah.
So you mentioned this, that there's some deep-seated mistrust,
Mhm.
and I'm wondering how we can fix that. Basically, how can institutions and clinical researchers work to build more equitable and trusting relationships?
Yeah, I say that, it ultimately starts with just knowing that trust. It's about that trust, and trust is earned when communities feel seen, they feel heard, they feel respected, and they feel empowered,
Mm.
and not just studied. There are a lot of times when it's we want to get you involved in this so we can raise our numbers, so we
Yeah.
can reach. Without ever thinking about the person behind what you're trying to do. So I always say, it's trust building is that very first step. It's
Yeah.
so important. Um, I think that those harms that I just spoke about, they have to be acknowledged. You have to acknowledge those openly, um, because until you acknowledge those and actually say, hey, yes, this happened.
Yeah.
We know this happened, and then talk about the things that are in place to um, keep those things from happening again. You know, I think you have to also include community voices at every step of the way. You can't just swoop in and say, hey, we're doing this uh, trial and we need you to be a part of it. It involves involving these people in the study design,
Hmm.
um, in that decision making process, and just at every step of the way is what I say.
Hmm.
Make sure that you have culturally relevant educational materials and things of that nature. Um, Another thing that I think is very important is investing long term. Um, don't just come in to get our information. Come in and get to know us, really get to know what our needs are within the community, and let's work together on meeting some of those needs versus just coming in, swooping in, getting what you need, and then we never see or hear from you again. So invest in the long term, come in and connect with our community leaders and tell them what you need, but don't just tell them what you need. Seek to find out how you can help to make the community better, because when the community is better, individuals are going to be more likely to help and say, yes, I'll participate because I see the value that it could bring for me, if not for me, my loved ones down the road.
Yeah. And would you say that involvement, just that asking, that talking, are those ways to make them feel seen and heard? And would you add more examples of how to do that?
Yeah. So, getting involved in the community, uh, coming in, finding out what goes on in the community, finding out those needs that the community needs, um, getting to know the people that you're trying to reach, because we are people. We want to be seen and heard, and we want our opinion to
Exactly.
count as well.
Yeah, that's exactly the word that just came to mind, is your opinion, your
Mhm.
thoughts and feelings on the matter.
Yeah.
What would you say are some common misconceptions and concerns that you've encountered that have discouraged participation in clinical trials?
Yeah. So, just speaking from experience, prior to getting on this journey, I had my preconceived notions about clinical research. Um, it was a last ditch effort. I thought that,
I did too.
yeah, it's like, wait, I'm not dying, am I? Aren't there other things that could be done? Um, Things like helping people understand that medications that have come to market that have not been tested on these populations may not work as well. You may not see the same type of results that you're seeing in other
Mm.
populations. So, just making sure that people understand that there's a reason that we want you to be in the clinical trial. And I'm going to go back even a step further. You know, we think of clinical research, and a lot of times we think of, I don't want to be that guinea pig. Um, and I thought that too. I didn't want to be a guinea pig. You know, what is this? I didn't want to get a placebo or a sugar pill. You know, I often thought about that.
Yeah.
But then once I learned that everything, even that Tylenol that I take, that ibuprofen that I take, it went through the process of a clinical trial. It didn't just appear on the market.
Hmm.
So I think about, yes, it's been around for years and years, but it had to go through that same testing to be brought forward there. So um, it's just, I call them myths. You know, you have to debunk the myths in order to make things come alive. And most clinical trials, people don't understand that you're not going to get a sugar pill. You're going to get the standard of care. You're going to
Right.
be guaranteed to get the best, and then you may get something that's even better. So I think when people have a understanding of how that works, they are more likely willing to participate in a clinical research.
Yeah, you mentioned myths. Do you think there are any myths in particular that stand out with the communities that we're talking about? Are there
Mhm.
any others?
Yeah, so I think about you know, how how am I going to make this happen? A lot of times it's, you have to go to work. You can't, if it's something that you have to take off, there's this myth, well, I'm going to have to be laid up in the hospital the whole time, or, things like that. And that's not the case. There are
Yeah.
so many trials now. And when I say clinical research, we have to understand that it isn't always a trial. It could be something as simple as a study, an observational study,
Hmm.
or a questionnaire that you complete. All of that is a part of research as well. It's just a clinical trial piece that is going to really make change when it comes to new medications coming to the market. So it's just addressing all of those things. And I said, the myth about it being the last result, the myth
Right.
about you getting the sugar pill, the myth about uh, it's going to cost you out of pocket. You can't pay, what
Mhm.
it costs out of pocket to have that done. All of those are myths, untruths.
Wow. Yeah, I've learned so much about clinical trials from you today and from the other, episodes we've done in this series because like you, I thought it was a last ditch thing.
Mhm.
I didn't think of it in terms of being able to help advance
Yeah,
science research and all of that, and I
yeah,
think that's an important distinction.
yeah.
Is there anything else that you'd like to share, just in terms of kind of the background, the root causes, the underlying challenges in terms of clinical trials in these communities?
Yeah, so, I think of the challenges, and a lot of them are, um, the disparities that these communities deal with. A lot of times it may be a language barrier.
Yeah.
It may be a transportation barrier. It may be an access barrier or something of that nature. But all of those things have to be kind of addressed before we can kind of move on to even say, would you consider being in a clinical trial? And I say that to say it's about educating the community. Um, because these communities, a lot of these communities want to actually participate and make a difference. They just don't understand what the process is, and they have difficulty with getting over some of the barriers that they do face.
Yeah. Well, Valerie, thank you so much. I get to spend another episode with you, but we're gonna bring this one to a close. Next time, we're gonna take it a little deeper. We're gonna talk about breaking barriers and creating change, in clinical research. So, Valerie, thank you so much, and
Thank
we'll
you.
see you on the next episode.
Awesome. Thank you.